But talking about heat wave, we have to address the issue of heat stroke. Like we were talking and chatting up with Shrishti as well, this entire heat wave situation is going to coincide with elections. So it's very important, like I said, that you go out and vote, but you take care of yourself while you do that. So we decided to sort of break it down for you. What exactly is a heat stroke and how can you take care of yourself? Dr. Farah joins us now. She's the director at internal medicine at Fortis Hiranandani Hospital here in Mumbai. Good morning, doctor. Good to see you. We are still in bearable temperatures at the moment, but if Shrishti and IMD are right, that means that the time ahead is going to be a harsh summer. So firstly, can you define for our viewers what exactly is a heat stroke and how do we know that one is getting a heat stroke?
Yeah, good morning to you. A pleasant good morning indeed to you and to our viewers. So it's the right time to discuss this topic. Heat stroke actually is a continuum and an extreme and the most severe form of heat illness. This is when the body is not able to tackle with the rising temperature outside. That means when your body temperature goes to more than 104 degrees Fahrenheit or 40 degrees Celsius. It is this time when the defense mechanism of the body to protect you from heat, that is sweating, gets affected, and then you get heat stroke. And this is, as I've said, when the temperature crosses 104 degrees Fahrenheit and there is a neurological involvement. That is called as a heat stroke.
Right. So, and heat stroke can be lethal. It lands people in hospitals.
Yes,
it takes away lives as well. We hear of so many stories coming in from the hinterlands that people don't take care of it. So how does one know that that the person has got a heat stroke?
Yes, as rightly said, heat stroke can be lethal to up to 80%. And if you handle it properly, accurately, on time, you can bring down that lethality percentage to less than 10%. So you have to take precautions, especially this season, to prevent yourself from getting affected by the heat wave. This usually happens when there are more frequent and continuous heat waves. And when we are exposed to the heat for a long time, then you suffer from heat stroke.
But are there any signs?
Yes, there can be signs, So when the person is exposed to hot sun, patient may start getting the symptoms. Patient may start feeling lethargic, irritable, may feel nauseous, may even vomit, may have bad headaches. Some people affected with heat stroke can have profuse sweating, while some of them may not sweat at all because the mechanism gets lost. So in that case, the skin becomes very hot, red, dry, and very bad headaches you have, and then it goes on and it progresses to a person who can faint also, and then you can get seizures, that is convulsions. You may even lose your consciousness. You can even go into coma. Initially, when you have this lethargic feeling, irritability, your temperature is going up, your pulse rate can also go up, your respiratory rate can go up. So with these signs, and when you are under the sun, and when you are otherwise normal, and in fact those who have other comorbidities are in fact more prone to this, you should take immediate action. Move to a cooler place and start rest of the things to prevent yourself from getting affected further.
So you've got to control your body temperature, but you've also got to take care of your liquid intake, right?
True.
To ensure that you're not getting dehydrated. That's where it starts. So what should one do? So say somebody has to go out, or kids have to go out, elders go out, nobody wants to stay in their houses, we want to venture. So one is to avoid definitely going out in peak sort of heat hours. That means in the afternoons, try and stay indoors as much as possible. But even if you have to step out, how much water should one really be drinking to keep a check?
Yeah, so it's very important to keep yourself hydrated. Normal person without any comorbidities, where there is no fluid restriction advice, is supposed to drink 3 liters of water in a day. But if you are sweating, if you have nausea, vomiting, or if you have loose motions, you have to compensate that much extra amount. So you carry a water bottle with you. Keep on sipping water. And then other things also you have to follow, apart from your fluid intake. Now for fluid, you can have water, as I've said, 3 to 4 liters in a day. In summertime, if you are sweating, you have still more water intake. You can even have some juices. You can have even oral hydration solutions because
Like ORS.
ORS, because when you sweat, you not only lose fluid, but you also lose electrolytes from the body. So you get this weakness and cramps and other things because of that. So one is fluid intake. Second is the type of clothes you wear. Preferably you should wear light colored, preferably white cottons. Why cotton I'm saying? Because one is it is good for your skin. It will absorb the sweat when you sweat, and also it is a breathable fabric. It will allow exchange of air. It will keep your body cool. Then secondly, you should wear a cap if you're moving out. You should use a sunscreen which is of at least SPF of 30 and more. And the very first instance, I will tell you that you should avoid going under hot sun unless it's an emergency. You try to schedule your timings of your work in such a way that you finish most of the portion of your work before the sun is at its maximum, before the hottest part of the day starts, that's between 12 to 4 p.m. and then rest of the work in the evenings. But if at all you have to move, use a vehicle, use a car which has AC preferably, or you can travel in a vehicle. Don't walk, and never walk barefoot.
I like this input of even wearing the right kind of clothes to ensure.
True.
But eating right is also important, isn't it?
Very right, yeah. So you should have a light diet. Hydrate yourself more. Have more of liquids and a light diet. If you have spicy food, masalas, curries and all, that will increase your metabolism further. That will add to your sweating. So that's not good for summers. You should have light diet. You should drink lot of water and protect yourself from the direct effect of the sun.
That's right. So those are some good tips for everybody to keep in mind, because as the doctor also pointed out, heat stroke cannot be taken lightly. 80% of people who get heat strokes actually end up in hospitals. So let's not take that lightly at all, and let's ensure that, you are not one of them, and it can easily be avoided if you just follow those tips. So thank you so much, doctor, for joining us and sharing all those details with us.